Good evening, everyone present here. Today, we are having another session of teleconsultation regarding COVID 19. Today, we have Dr. Bulu Nahak for this consultation session. So, let's start with the session. Good evening, sir. Welcome on this session.
Good evening. Today we will discuss how coronavirus kills, what are the constitutional symptoms, what is the difference from first wave from second wave, and how one can be treated at home, and what are the indications that patient is trying to patient transfer to the hospital.
Yes,
So
sir.
first of all,
So, first thing I want to ask you that what is the current situation of COVID 19 in our country?
current situation everybody knows from TV, media, these all things. The
Yes, sir.
cases are rising in number, deaths also rising, hospital beds are empty, patients are dying on roadside, the oxygen cylinder, oxygen concentrator, everything is scarcity going on. This is the scenario, pandemic. This is the one of the horrible scenario going on at present all over all of states. So hope after 2 to 3 weeks the core bill flat, and after the oxygen requirement, the concentrator, everything gets ready, then core supposed to flat after 2 weeks. That situation is not good at present. Almost all hospitals, same scenario.
Yes, sir, that's honestly true. The situation is getting worse day by day. Let's hope the situation will get recovered soon. Heading to my next question, sir. Yesterday, only in the news, they were showing that the research has found the third wave is also going to come. So, any idea about this third wave?
Uh, they told third wave going to occur because recently Andhra Pradesh, one mutant strain, something is they found out. It is different mutant, different from South Africa, that is US, and the
Yes.
Brazil, that is there, and a typical another mutant that I have not seen anywhere in across the globe.
Oh,
That they
God.
are suspecting, predicting that third wave might occur soon. That is the thing. The number of cases as they are going on from every day. So
Yes.
in India is a huge population. So many mutants come from different platforms. The last West Bengal, so many mutants are coming. Andhra Pradesh, so many states, different mutants are coming day by day. So they are suspecting third wave might occur very soon. That is the thing.
Okay, so this is a dangerous thing, I will say. And talking about the first two wave, what are your views? Like how the first wave and second wave is?
First wave, you see, last 1 month, the number of cases is the number of cases increases not occurred last 1 year. Last
Yes.
1 month, the 4 lakhs cases daily, 4,000, around 4,000 deaths per day, not occurred that last year. One thing. Second is in this second wave, almost all family, entire group, community is affected. Not occurred that time. Only one
Yes.
family of a person or group or community is affected. But here, almost all are affected. Almost all are symptomatic. That requires
Yes.
some needs hospitalization, and some deaths are also occurring. In that case, these deaths are very minimal. This web is very high fatality, high transmission rate, and occurs almost all age groups. And apart from that web, first web, the high risk people and people of old age groups more than 60, they are affected, and they suffer that particular group. And that is that different. This is mutant strain, highly fatal, highly dangerous, high transmission rate, occurs
Yes.
involves almost all age groups. That is the
Yes.
symptoms also some different, that skin changes, eye changes, something loose motion, GI changes not occur that time. Though loss of smell, taste, and fever, cough, runny nose occur, but these are the some new symptoms occurring because of all mutants. The virus is changes itself. That is the thing.
Yes. So, if we look at the graph, like in the first wave, the number of senior citizen was more at for death rate, but in the
Hmm.
second wave, not only senior citizen, but mostly the young generation is affected. Any specific reason for this, sir?
That is the thing, madam. I told that because of mutants. They are mutants. This is not the coronavirus, original coronavirus. The coronavirus is changed its shape, size, morphology, everything. They are mutants. That is region occurring, affecting almost all age groups. Mutants.
Okay. Another question, sir. Like we all know that wearing a mask, using sanitizer, all these things are needed to keep us protected from coronavirus. But is there any another specific thing we should do to prevent ourselves from coronavirus? eating
Sorry.
some. I said like wearing a mask, sanitizer, all these things are
Mm.
needed. But other than this, is there any other thing we should do to protect ourselves?
See, best thing is to keep isolate yourself, stay home. The second thing is uh, uh, you limit your movements.
Okay.
Movements don't go to groups where crowded occurs. The low ventilation is not good. Limit yourself as mixing. The mixing nature should go. And second third is the vaccination. If you get a
Yes.
chance to get vaccinated, you get vaccinated early. The number of people will vaccinate early. This flat core will hope the core will flat. The immunity will hard immunity will develop. More than 67%, 70% people if vaccinated, they will get immunity and the core will rise flat. I think.
Hopefully, everyone will get vaccinated as soon as possible, sir. Heading to my next question. So, there are sometimes some mild symptoms in everyone's body, or some people get some mild symptoms. Later, when they get checkup or analyzed, they found that it is a severe level of corona. So, how should people recognize that I am having this and I should get readily go to the doctor or consult a doctor as early as possible?
Two things. One is mild symptoms and moderate to severe symptoms. In mild symptoms, you will be treated at a home. You will be treated at a home. That means doesn't mean self medication. You are not the doctor of yourself. You will consult a doctor, your personal doctor, family doctor, and according to the doctor's suggestion, you will take medicines at home. Your home is your hospital. In mild symptoms. In case of severe symptoms, that you will be transferred to hospital. But the mild symptoms like constitution fever, runny nose, cough, sore throat, these are loose motion, these all things, these are nasal stuffiness, sore throat, these all things are mild symptoms. If saturation, if you are not desaturating, your saturation level is more than 96, 94, then these all constitutional symptoms will be taken as a mild symptoms. And you
Okay,
consult your
doctor.
personal family doctor, then you start isolating yourself. First you start you isolating yourself, then sometimes what people do, I will go for a covid test, RT-PCR test. If I'm positive, then I will isolate. No, that is not thing. Unless this, if these symptoms are present, unless otherwise proved, you take it, you are affected by corona.
Okay.
100% guaranteed you are affected by corona. So COVID positive, you are COVID positive. If in case of the RT-PCR test comes positive in 70% of cases, in case of 30% cases, the RT-PCR test comes negative. Although their
Yes.
symptoms are present, but the RT-PCR test comes negative because of number one, because of mutants. The mutants there can be confirmed as genomic staining. That is not possible in India at present. Currently, the population level is so high, genomic stain can't be done in high number of population. Number one. Number two is because of the technician wrong faulty technique. The sample, the technician, some what they are doing, some are calling the technician to come at home and take my artificial sampling. The artificial sampling, the technician, they sometimes instead of taking from nasopharynx, they take from outer nose. The virus won't
Yes.
come from outer nose. Point number
Okay.
one. Point number two, the transport media. How they are transporting, that is another point to be noted. Third is
Okay.
the lab results. So because of these all things, the RT-PCR test won't come positive. In 70% of cases, it will come positive. Rest 30 to 40, 60. Now the rate are false negative cases high. 30 to 40% false negative. Some are doing double testing. Some are traveling from here to there to get tested again to test positive, and then they will isolate. Don't do that. If you have these symptoms, you get fast isolate yourself. Consult your personal doctor. Start uh, medications. What the doctors, your personal doctor tells. You don't self medicate yourself. Consult your personal
Yes.
doctor. The most important medicine is the paracetamol.
Hmm.
Otherwise, some they are advising the ivermectin, doxycycline, okay, azithromycin. These are not proven, but paracetamol you take every 8 hourly till temperature. You don't wait for temperature to subside. You take paracetamol. Okay, plenty of hydration, good diet, nutrition. Okay, these are the first
Basics.
most important mindset. You keep your mindset cool. If you get panic everything, then your adrenaline temperature and stress hormone level will rise, and the body immunity will fall, and the body can't fight with the virus. So you first important, you keep isolate for yourself, and once the sign symptoms develop, don't wait for artificial result, and don't go to labs, HRCD4, interleukin D dimer. These tests are, if
Okay.
once you are long involvement in there, these tests are valid, necessary once you are admitted into the hospital. In home care, these tests are don't have any value. First,
Okay.
second thing, what are the time when you will go to the hospital? What are the warning signs, what are the danger signs or red flag signs that hospital attention is needed? When
Mm.
a continuous cough is there after 5 to 7 days, continuous
Okay.
cough, temperature, high grade temperature not subsiding. Okay.
Okay.
The patient is developing altered sensorium. The consciousness is sensorium is something, patient is deteriorating. Severe loose motion, saturation below 92. Okay. If these are the signs are present after 5 to 7 days of treatment, then it is time to go to the hospital.
Okay. So all these things are noted, sir. Thank you so much. Talking about toward the vaccine point. So there are many people who says that they won't take vaccines because side effects are there, or they says that even after taking the vaccine they get positive. So what you will say about this thing?
Vaccines, uh, side effect. First, we should discuss about the effects. Do vaccines does any effects on the body? Yes,
Yeah.
it does have an effect. Side effects are there, everything. You are take paracetamol, there is side effect, analgesic nephropathy. So you won't take paracetamol for fever. No, that is
Right.
the some things that is that people are doing. But this is, first we should talk about effects. Side effect is unwarranted, negligible. What are the effects if the vaccine we are taking that should fight against the virus? Yes, that is
Yes.
proven. Now CDC, US CDC, that is proven some topic that the India Covaxin has capacity to fight 371 strains of mutants of coronavirus. So vaccines are effective, no doubt. Vaccines can be you once you have those some people have taken second dose of vaccine. Vaccines might render positive, might them you will develop positive, but vaccines reduce the mortality rate. The mortality
Okay.
rate, the hospital admission rate, vaccines drastically reduce. But you might develop positive because the antibody already antigen inserted in the body. Even every antigen antibody reaction, you might develop positive, mildly asymptomatic, but the hospital admission rate and mortality rate significantly reduce if someone has taken second dose of vaccine.
Okay. Thank you, sir, for this. So I want to ask, like, how the vaccine help to create the antibodies, or how it works in our body.
What happened if some vaccines inserted in the body? Vaccine, the particular vaccine is already that antigen, the immunogenic response again. Listen, what happened first, in what happened, the coronavirus is a SAT protein. The coronavirus is spike protein. The spike protein, the already they have developed that spike protein, and they brought the vaccine already they were inserted. Now the vaccine jo immunogenic property, they have already recognized the spike protein. Now body will develop antibodies against spike protein.
Okay.
Already the immunogenicity already they are in the clones in the
Mhm.
vaccine
Okay.
vial. They have already developed. The once inserted into the body will start developing antibodies against the coronavirus spike protein. Once coronavirus infects, see coronavirus, the projections are there. That is a spike protein. Once coronavirus inserts, that the antibodies already present in our body, that will coagulate, that will neutralize the virus.
Okay.
That is the thing. What happens in normal things, the antibody, if once coronavirus, if someone is not taken vaccine, if coronavirus is inserted in infected our body, the body will start developing antibodies after 7 to 8 days, because the body has not recognized the spike protein yet. It will take some time to recognize the spike protein. In case of
Okay.
vaccines, the already spike protein they have recognized, inserted. So just insert the body, production antibodies. Once virus affects, that will neutralize the spike protein already.
Okay. Sir, do you think only the two dosage of vaccine will be enough for us to fight with coronavirus, or more vaccine will be needed?
I don't think so, madam, because of new mutant strains are coming. They are planning for booster doses also. Because this
Okay.
vaccine they have already produced in 4 to 6 months back. That time the second wave, first wave, where there are no or few mutants are there. Now already mutants, so many variants of mutants that came out. They are planning for booster doses. I think the new strains, new size shape virus they will insert again, and the body will have different level of antibodies. So what 2 doses are not enough. I think my personal view, booster doses might come in future.
Okay, so heading to my next question, sir. Everyone is saying that we should use double mask, but some people say they get problem of breathing. So exactly what to do? Rather, we should use double mask or not?
Not necessarily double mask. If you are using N95 mask properly, that the mask should cover the upper part of
Yes.
nose and the chin. Check it's tightly fixed. Then there is no use of double mask. If someone is using that rumal, someone using that surgical mask, then it's a double or triple mask required. But one N95 mask is enough. N95 mask has 95% filterability. When the virus chances more than 95% virus are getting chances to get filtered out of from that tree. So one mask is N95, that is enough, but that properly should be there. Sometimes from nose, some people are wearing from
Yes.
nose, from throat, from this side, from that side. That is wrong.
Yes. Sir, research was saying that in Australia or in US, they are trying to give dosage like one dose of Covaxin, one dose of Covishield. They are trying all these things. So, can be this work in India also?
They are giving mixed vaccines.
Yes,
One
mixed
Covaxin, one
vaccine.
Covishield.
Yes, sir.
Uh, no idea, ma'am.
Okay.
This is I perfect no
Okay,
idea.
sir. If one of my family member is being COVID positive, then what precautions should I take so that I won't get positive?
First of all, you tell your family member, oh, one member is positive, you tell the other members that first symptoms are there in my body, I might be suffering from corona, I will isolate myself. First thing, you isolate yourself before getting tested on. You isolate yourself in a single room where the ventilation is good, and the ventilation, your air should not, that room is not, that air should not circulate from one's own room to other rooms, because the virus may circulate in the air.
That's
That room
yes.
is properly bathroom attached, and okay, that air should go outside, not other another room. Okay, 2 BHK, 3 BHK,
Yes.
that one room from the air should go other room. That's not done. First, you get isolated yourself. Okay, properly you tell someone to give your food something from outside. Go keep and from table and go there. If elderly people are there, elderly comorbid elderly seamen like this cerebrovascular accident, chemotherapy, cancer patients, chronic liver, kidney, heart patients, and some
Yes.
obese patients, age more than 60. Try to shift from them from another room. Try to relocate or shift from their room to another room, because the chances they getting infected more. Okay. One bathroom should be exhaust fan, because of whatever virus circulation into your room that should get flushed out. There must have an
Yes.
exhaust fan. Okay. The food should be like this. Then come to diet. Medication, high protein diet should be advised. Not that high protein diet like you can paneer, that egg, that all soybean, these all things. Oily carbohydrate fat should be avoided. Okay. The next come to medications. As I told, medications, you should consult your doctor, personal doctor, not self-medicated. You don't take medicines of yourself. Consult your personal family doctor. Ask such symptoms are there. What are the medications? Most important medication is paracetamol. Some asking for doxycycline, ivermectin, azithromycin, because of these all medicines not proven. As if we are taking fast COVID wave, that hydroxychloroquine, these are the same thing, not proven. But only one drug is proven, that is paracetamol, some vitamin C and G, plenty of hydration, because the coronavirus they call so many loose diarrhea, loose motions. If you get loose motion, so many diarrhea, the body will get dehydrated and altered sensitivity, the sodium, potassium, all things will change. You get plenty of hydration. Okay. Then next, mindset, you should keep yourself cool, calm, quiet, don't give panic. If you get stressed, then the stress hormones will release and the body immunity will subside. And these are the, if such warning signs are present, these are high grade fever,
Mm.
continuous fever, continuous cough, okay, high grade fever, altered sensorium, then it is saturation, desaturated oxygen saturation less than 90, heart heart rate more than 100, and respiratory rate more than 30. These are all things it's time to get plan for hospital admission. These are the things.
Okay. So heading to my next question, I would like to ask that there are some small children in the house who get they have the symptoms of covid positive, but they don't know like they have all these things because they are small and they roam here and there. So at that point, what should else people do to keep them isolated, to keep them away from other people? Because small children don't know like they have covid symptoms, they just roam here and there.
Mm. Children are asymptomatic areas. Children sometimes don't develop symptoms, but they're asymptomatic areas. If any of these symptoms develop, the breathlessness, dyspnea, cough, fever, runny nose, sore throat, anything develop, you prove this is COVID or Corona unless otherwise proved. Sometimes some people think this is common cold. Sometimes if I have taken from cold water bath or fridge by ice cream, these all things, no. If these symptoms are present, you treat yourself. This is your child is suffering from coronavirus or COVID-19. At this point of time, your mother will act as a doctor. This mother, children's mother will act as a doctor. You mother and children isolate themselves in one room. Okay? Mother always is mask, hand washing, sanitize everything. Do mother same thing. Consult a personal doctor or family doctor if these are the symptoms. These are symptoms. What to do? You monitor temperature, pulse oximeter saturation, monitor every 2 hourly temperature, saturation, how much children's passing stools, each loose watery stool. You calculate the output, how much water you are taking, how much input and output. These all things. Saturation, monitor if developing severe cough, fever, high grade fever per 2 to 3 days. These all things monitor. These are, I think, children are not that much fatality rate, unlike the uh, children's not yet, unlike the middle age and young adults. So the same symptoms. You will take paracetamol, this vitamin C, zinc, antibiotics. Some antibiotics have no role, but become our prescribing. Keep your isolates yourself. Plenty of hydration, good nutrition diet. Then mother always masked. Then they will develop no issues.
So what nutritious food all people should take to increase the immune system?
That that is the thing. The nutritious food include the high protein diet. That point of time in COVID percent, that corona time, the patient have the loss of taste, loss of a smell, everything there. They have the smell, taste, they have gone. They are not interested in any food, so the appetite is gone. Say high protein diet. They advise for high protein diet. They include that some chicken, but not in oil. Chicken, that egg, okay, soya bean, that paneer. These all things are advised. Carbohydrate and fat foods advised. How fresh fruits, vegetables, plenty of hydration. Okay, these are the things. High protein diet specifically advised.
Okay, sir. So there were news in the social media like the people who are obsessed are more likely to get coronavirus. Is this true?
Yes, this is true. If obese person, these are the because of this immunocompromised. Obese persons are partly immunocompromised. Immunocompromised means the antibody secretion is less compared to normal healthy persons. So the antibody less antibody secreted, so it can't neutralize the antigens or virus spike proteins present in the body. So the virus takes the upper hand. They are more affected obese persons. That is true.
Sir, if a person is suffering from cancer, diabetes, or any other some high issues, healthy issues, I will say, then what more precautions they should take if they are subjected or suspected as COVID positive?
Same thing, that is because of if they are high risk factor, the cerebral vascular accident, chronic long kidney disease, chemotherapy patients, age more than 60, they are immunocompromised actually. Immunocompromised means the antibody secretion in normal healthy persons, that to compare to them is very low, so they can't neutralize the virus present in the body. They are immunocompromised. So what you will do, they are the most important things. If one family member positive inside home, if some high risk patients are present, then try to relocate them to another house or another room, or from away from your room. First relocate them, don't keep them near your house, nearby you. Relocate them. Same thing if such symptoms develop, their saturation is monitor, oxygen saturation, vitals, temperature, respiratory rate. Okay, these are all things you monitor. If these things, warning signs I told, when saturation falls below 92, heart rate is more than 100, BP less than 100, ठीक है, और pulse rate more than 100, respiratory rate more than 30, temperature high grade temperature not subsiding after 5 days, 4 to 5 days of treatment, ठीक है, patient developing breathlessness, altered sensation, it is time to get admitted inside the hospital.
Sorry, sir, some network issue.
ठीक है, ठीक है.
So again, toward that question, like what precautions they should take if a patient is suffering from cancer, diabetes, and all these things, and they are suspected being COVID positive.
That is the thing. You monitor vitals, temperature, heart rate, pulse, saturation. ठीक है. If temperature is continuous, high grade for 4 to 5 days, continuous cough, loose motion, altered sensorium, saturation, respiratory rate, everything you monitor. Then if consult your personal doctor or family doctor, try to treat it at home. If such warning signs like temperature high, not subsiding after 5 days or 4 to 5 days treatment, continuous cough or continuous loose motion, patient developing altered sensorium, ठीक है, saturation falls below 90 to 94, then these all things, respiratory rate more than 30, pulse rate more than 100, blood pressure less than 100, it is time to get admitted inside the hospital, because immunocompromised patients, these are all partly immunocompromised patients. The lung function is lung capacity is not good at young adult patients, so
Yes,
there are high chance of developing a pneumonia, respiratory respiratory acute respiratory distress syndrome, and DIC, and disseminated intravascular coagulation. Within the short span of time, they might deteriorate and go to another direction. So that is they are a high risk factor. They are must keep a close watch them.
So exactly how COVID, if a person is being a COVID positive at a severe level, so how exactly that COVID works in a body? What exactly starts get destroying in our body first that lead to death?
That is exactly, ma'am. That is the important question. When a normal person, if a corona positive, COVID positive patient sneeze or cough, the millions of droplets they circulate in the air. What happens? The droplets, when a normal non-COVID person comes from other side, not wearing any mask, he inhales the droplets. The droplets contain millions and millions of virus, but the droplets don't directly transmit inside the air. The droplets get attached inside the dust particles present in the air. Another, if someone touches the paper, plastic, polythene, cardboard, anything, that if I'm not any gloves, touches, and I touches my nose and throat, that virus go through the nose, throat in the respiratory system. And what happens? The coronavirus is a set protein. I told the other part, the body has S2 protein, S2 protein. The coronavirus has special affinity for S2 protein. You take that the coronavirus is a spike protein, that is the key. The lock is there inside the respiratory system, that is the S2 protein. Exactly the key will go into fit in the lock. That is the there. That is why the coronavirus patients suffer from pneumonia, respiratory disease, lung disease, because of respiratory compromise, ICU, ventilator. Because of this, coronavirus has special affinity for the cells present in the respiratory system, that is the lungs. So what happens when coronavirus enters? Once coronavirus enters in the body, it will to laryngotracheal tree, it will go to the lungs in the alveoli. The alveoli is the key landmark, the unit of lungs function. What the alveoli? Now the coronavirus will tell the alveoli cells, it will attach the spike protein as coronavirus, and attach the S2 proteins of alveoli. Now it will incorporate into the alveoli cells. Now the coronavirus will tell you stop working what you are working presently before. Now do what I am telling. The coronavirus is mRNA has inserted in the normal alveoli cell. Now the normal cell will function as the guide of the order of the coronavirus. The coronavirus will copy millions and millions of copy inside a single cell. At a point of time, it will get a rupture, blast. So the cells will circulate into the circulation. What happens that point of time when they circulate, this takes from insertion from day 1 to circulation, they from 2 to 10 days. From this is the 2 to 10 days is called the incubation period. In that incubation period, these cells are released into the circulation. At that point of time, our body innate immune system will come into the play. The innate immune system will recognize that the coronavirus circulation, the antibodies are there. I have to neutralize. Normal, they start secreting antibodies. The antibodies will go and directly attach the coronavirus of
No.
spike protein, and will try to neutralize it. In case of immunocompromised, but the antibody secrecy is less, so the virus takes the upper hand. That is the
Okay.
thing. Now the coronavirus will the antibody the coronavirus, the body will secrete antibodies that will neutralize the coronavirus. You will tell why the coronavirus, the body took so much time to develop antibodies, because the body
Yes.
has not recognized the spike protein yet. It will take some time to recognize the spike protein. The antibody secretion will production will take some time. The body will recognize the antibody, then antigen, that will secrete the antibodies. Now at that point of time, the macrophage coming to the play. The macrophage, antibody, everything will try to engulf the coronavirus. That is the thing. In case where the coronavirus in the fight, the antigen antibody fight, that the constitutive symptom, fever, cough, rash, fever, diarrhea, cough. This
Yes.
because of this antigen antibody reaction fight inside going on. That is the because of the hostile environment, the fever develops. In case of
Okay.
chronic long fight, the antibodies get suppressed and the pulmonary macrophages come into play. The pulmonary macrophage and again will fight the coronavirus. That will in fighting they will secrete the fluid inside the lung alveoli, develop pneumonia, air saturation decreases.
Okay. So regarding the COVID-19, many people says that using Ayurvedic medicine, Ayurvedic some or the churna and all this, it helps to increase the immune system. Is this good to take Ayurvedic related something, or it is better to consult the doctor?
Better to consult the doctor, obviously. But Ayurvedic products, as you know, they are the immunity boosters. Immunity boosters, that the body, the immunity function will act as a good. The antibody production will be healthy. That is the thing. Some people are taking Ayurvedic, but I have personally, if you consult a doctor, then Ayurvedic product that is good. I think as a allopathic doctor, I can't suggest what Ayurvedic medicine there. Better to consult the doctor and take. Some people are taking, but it is good working. We can't
Uh,
deny
so,
this.
so why vaccines under 18 are not allowed yet?
Vaccines under 18, because of these vaccines are live vaccines. The
Hey,
Covaxin, COVID, these
hey,
vaccines,
hey guys.
Hello?
the vaccines will develop severe allergic reaction, angioneurotic edema. These all vaccines, these allergic angioneurotic edema, these will develop in under the 18. Because of the children, these vaccines, the children, the airway will be compromised. In small, minimal mucosal inflammation in laryngotrachal, that will reduce the 50% airway. Because of these things, the vaccines are not advisable below 18 years because of allergic, severe anaphylactic reaction, allergic reaction. These all things. They are trying to develop how children young could be vaccinated further. They are developing new molecules.
Okay, so heading to the next question. Some people are forced to go out, like always doctors, nurses, some ambulance driver, and many other people. They need to go out to work. So, what more precautions they should take so that they won't get affected by COVID-19 or their family won't get affected by all these things? Because to work is what necessary today. So, what
Uh,
precautions which they should take?
if you tell at this point of time, the more people are severely affected the healthcare system. The healthcare system is collapsed, and the health personnel are exhausted, tired. Man, this is the thing. But you have to work same. We are not taking special precautions that mask the personal. If you go to COVID rounds, that personal protective equipments we are wearing, the glass, gloves, gown, face shield, cover, these are all things we are wearing. That doffing is most important. When you are reviewing the personal protective equipment, that is more important. You talk with a patient, keep a 1 meter distance, ask the patient to tell their complaints and do. When you use your glasses, some people are telling that the coronavirus is transmitting through conjunctiva. So some are using face shields, mask is a must, and gloves is a
Yes.
must. Okay. So this upper part of neck should be covered. That like the nose, throat, and eyes, and
Okay.
hands you are touching. This is you will take precautions and go to the ward and ask God to help. If at the end, the God will save you.
Yes, sir. Let's hope for that best. Talking about sir, what government is doing, so do you think only the lockdown is solution to stop the coronavirus, or else restrictions should be there to stop all this chain or gathering of people?
The lockdown actually refer to restriction, mixing, to avoid mixing, to stop mixing, association, gathering, union. Lockdown is that part only because once one patient it gets positive, it will travel to go to park, gym, this, that, everything. They will infect number of people. That is we have to break that chain. Once detect a positive, stay at home, okay, get isolated and don't infect others so that the chain will break.
Yes, great.
That is the part of lockdown. Actually, this is the lockdown. They are planning for lockdown. That only lockdown is no solution. We have to vaccinate the people as soon as possible within a short span of time. The number of people vaccinated, see, that will develop herd immunity and the fatality rate, the transmission rate will subside. Some government centers, some private centers, the vaccines are there giving. But vaccines, the long queue, the vaccines, the all things vaccine. How to the vaccines still some are registering not vaccine getting vaccines still 5 to 7 days after. The more the rapidly the people will get vaccinated, the graph will flat. Again, same thing, the oxygen concentrator, oxygen cylinders, oxygen plant, they will more
Yes, sir.
produce oxygen, these ICU beds, that people will get admitted. And second the lockdown and vaccination, most important three things.
Yes, sir, that's really true, and we all should stay home for our own safety. So, heading to my next question, some people are just less symptomatic. They are not much symptoms, a few cold and some of the fever they have. Still, they wish to get hospitalized, which we all know, which results to less beds, less oxygen, and all these things. So, what advice you will give to all these people who really feel whenever they get positive, they feel that hospitalized is the only solution rather than isolating at home?
The thing is, no doubt that hospitals have the best healthcare facility and safer place than home, no doubt. There is no 1% doubt the hospitals are safe place than home. But at this point of time, the hospitals are stressed. There is no bed, people are sitting
Yes.
on the floor. So people should understand that hospitals at this point of time, if they go to hospital, their chances are acquiring infection is more.
Yes, sir.
They are getting more infected when to go to the hospital. The hospital, there is not a single bed, single hospital where beds or ICU are vacant at this point of time. Because of this panicness, people are getting panic. I might develop lung infection. I might develop pneumonia. I
Yes.
might develop
Yes, sir.
ARDS. My condition might deteriorate. What will I will do? I will find a safe place for a safe bed myself. I will get safe. That is the wrong actually. If you are mild symptoms, you get treated at home. Treated at home means doesn't mean self medication. You consult your family or personal doctor. Take medicines as your doctor prescribes. That is your home. Your home is your hospital at present for mild symptoms. Because of the panicness, this is all things the people are going to rush into hospital. But that is not required actually in mild symptoms. I told what are the medication, the diet, the
Yes.
nutrition, the mixing nature should avoid isolation, the medicines, the mindset, and what are the warning signs, red flag signs that we should go to the hospital. Already told.
Okay, so with this, I will think that we need to end the session because no more
Thank
questions, and you have solved lots of questions, lots of doubt of us, and thanks a lot, sir, for giving us your
thank
valuable time and
thank
consulting
you, ma'am.
us through this so goodly that everyone will get to know that what the seriousness of COVID-19 is and how we should protect ourselves. Let's hope people will stay home, stay safe, and will get recover as soon as possible. And even I hope that people that you should all get vaccinated, except side effects and all other things. Vaccination is important to remove the COVID-19 from our country. So thanks a lot, sir, not
Thank
only
you.
for being here for our consultation, but also for working as a front liner for our country. Thanks a lot. We respect you all. And with this, I think we will end the
Thank
session. And people just get vaccinated, stay home, stay safe. And thank you so once again for being here.
you.
Thank you.
Thank you so much, ma'am.